Is the combination of falling vaccination rates and misinformation about vaccine safety pushing the United States toward losing its measles-free status? That question is gaining urgency as South Carolina reports a sharp surge in measles cases. State health officials say that at least 88 new infections have been confirmed in the recent days, bringing the total number of cases since October to 646. The outbreak, which is now the largest in South Carolina in decades, is centered in Spartanburg, a town of about 39,000 people in the northwest of the state. More than 500 people, including students and staff across 15 schools, are currently in quarantine after being exposed to the virus. This virus has also spread to college campuses. Dozens of students at the Clemson University and Anderson University are now in quarantine. Measles, remember, is one of the most contagious diseases in the world. It spreads through the air when an infected person coughs or sneezes. Health experts say that up to 90% of unvaccinated people nearby can become infected after exposure. There is no scientific treatment for measles, and the virus can cause serious complications, including pneumonia, brain swelling, hospitalization, and death. The U.S. had declared measles eliminated back in the year 2000, meaning the virus was no longer spreading continuously within the country. For years after that milestone, cases were rare and mostly linked to unvaccinated travelers who contracted the virus abroad. And those cases generally did not lead to widespread outbreaks. 2 doses of the MMR vaccine, which protects against measles, mumps, and rubella, are proven safe and about 97% effective at preventing infection and severe disease. But health experts say that falling vaccination coverage is the primary driver of this current crisis in the U.S. Over the past 12 months, America has recorded more than 2,000 measles cases, the worst outbreaks in decades. Texas alone reported more than 700 cases in 2025, with 3 deaths as well. Utah and Arizona have also seen hundreds of infections. Experts warn that the recent changes to vaccine recommendations have created confusion about vaccine availability. The authority to modify the vaccine schedule belongs to the head of the Centers for Disease Control and Prevention and not the Congress. The recent changes were not based on new scientific publications, data, or information, and the consequences are not just theoretical. Children are getting sick, some are being hospitalized, and some are even dying. Other countries offer a warning. The UK lost its measles eradication status in 2019. Canada followed. And now, with sustained transmission and declining immunization rates, the US appears to be on the same path, and it could lose its measles-free status after an international review, which is expected this spring. Health officials say that the situation remains reversible, but only if vaccination rates rise quickly. And without that, measles, which is a disease once declared defeated in America, may once again become a permanent and deadly presence.